Joining us now is Dr. Sibongiseni Dhlomo, Chair of the Portfolio Committee on Health. Dr. Dhlomo, I appreciate your time. Thank you so much for joining us this afternoon.
Good afternoon, Hugo, and good afternoon to the viewers of Newzroom.
It's good to speak to you this afternoon, and I'd like to pick up on that conversation that we've just had with Veronica Mahwadi coming out from Cape Town, where 6 individuals suspected of this racket where they are manufacturing sausages with bone meal, which is, I mean, if you read what bone meal is, it is not fit for human consumption, and it is used in fertilizer and other organic processes. So what's your reaction to the number of individuals, syndicates, if you will, that are taking advantage of policing, if you will, to do these illegal activities, some of which have cost the lives of dear children?
Yeah, good afternoon, Hugo. That's not my area of focus because, you know, I'm the health activist and the chairperson of the Health Portfolio Committee. I want to start by offering condolences that we continue to do and say to members of these families who have lost these children so untimely. My main focus is on intervention 3 by the president on this speech, where he came in with the one that we are mainly dealing with now, the issues of what do you do with the spaza shops, regulations, governance, and the second one being the children, what is our welfare for them. The third one that I would like to concentrate mainly is this one of waste collection. When I was once associated with the Department of Health in KwaZulu-Natal, we did a cleanup campaign in Umlazi because we were under the impression that if you allow food garbage or household garbage to lie all over the township, you will then find that it becomes a breeding space for rodents and other rats. Now, the problem that we are dealing with here, as a public health person, you start there. What is the main problem? The main problem is that garbage has been lying all over, and the president was very clear, it's not all over South Africa, it's in specific areas, informal settlements and townships. That's where municipalities are not collecting garbage, and garbage is lying all over and therefore become the breeding space. Now, once you do that, rodents actually expand, and rodents will find time to go and want to get water and more food in households. And then this neighbor tells them how they kill the rodents, and it spreads like that. So we are getting on the organophosphates now, which is an issue. Starting point is that all households have got doomed because they want to kill flies and cockroaches. They've never been infested with so many rodents because of our own making, not collecting refuse, and refuse lying all over, and therefore becomes a health hazard. So all I'm actually saying from our point of view as health portfolios to say, we need to actually focus on the public health programs of hygiene, cleanliness, and making sure that we don't have these things all over lying around, because we are the cause by really getting municipalities not really collecting, and the environmental health specialists within municipalities not checking that garbage all over is becoming a breeding space for rodents. That's the main thing. All these other things, intervention number 1 and 2, will come on top of intervention 3 that has never been well looked after, well taken care of. You remove everything about cleanliness in the township, making refuse to be removed, then you don't have any intervention of people ever going to go and buy organophosphates to kill rodents in their space. This other one that we have raised is something that is very bizarre. I have never heard about it. I'm hearing for the first time that you are raising on this. But all that probably has to do with environmental health practitioners available or not available to do inspections.
Dr. Dhlomo, of all the issues that you've talked about, none seems to reflect on the solution that President Cyril Ramaphosa is suggesting. And what he's talked about is the re-registration of spaza shops and the closing down of those spaza shops that failed to register within a period of 21 days. Which of the solutions proffered by the president speaks to the issues that you've talked about, or is this missing in his cocktail of solutions?
Look, that is another economic cluster that looks into it. My main focus on the speech of the president is intervention number 3, which to me becomes my intervention number 1. You clean townships, you clean informal settlements, you then reduce a space for rodents to breed. Then you don't have very distressed customers to go to the shops and buy more than just a Doom, because Doom is a household insecticide good enough. They go out and tell the tube does not work for rodents, and they look for something stronger, which is not what they are supposed to buy, because that is for agricultural use. So all I'm saying that my focus would be strongly on intervention one, regulating, getting them to be registered on time. Not there's something else, somebody else is going to do that, but the immediate focus. If we could have these imbizos in the country of all of us getting to the ground and clean townships and make sure municipalities bring the bins for the township people to load their waste and garbage in there, then you will not have this problem that we have.
Okay, Dr. Dhlomo, let's focus on the area which you'd like to focus on. Now, how practical is this in all reasonableness? Because one of the reasons that the ANC lost the majority has been because of service delivery across the country. How practical is it? What are the steps do you think are needed to get the various municipalities to a stage where they can clean up that garbage and then don't have to buy doom, as you say, or other chemicals to deal with rodents?
Well, why is Johannesburg Municipality Metro able to collect garbage in Sandton and not in Soweto? Why is eThekwini Metro able to collect garbage in Durban North and not at Umlazi? Why? Why do we do that? This is the same administration choosing to collect garbage here and not collect garbage this side. That's a simple thing to do. Just collect garbage everywhere. There are no rodents that are roaming the streets in Durban North. There are none. There are no rodents roaming the streets in large numbers in Westville, all those suburbs. But they are in Umlazi and Kwamashu. Why are we doing it that way? That's my starting point. We don't have residents all over in Westville worried about rodents and therefore have to buy organophosphates, table phos. They don't, because that comes as a reaction to the problems that the country faces in townships and informal settlements where garbage is not being collected and becomes a breeding space for rodents. That's all I'm saying.
So what is your conversation, for instance, if you were to speak to the government of Gauteng around garbage not being collected in Soweto, not being collected in the townships?
What do you mean? What is our conversation?
I'm saying that you are saying that garbage is collected in Sandton, but it is not collected in Soweto. Now, as a chair of the Portfolio Committee on Health, what will be the nature of your conversation with the authorities responsible for ensuring that garbage should be collected from the townships?
The point would be, if you want to actually address this problem, you must adhere to the principles and practices of public health. Cleanliness, hygiene will then remove what we are facing here now. All other things of that spaza shop, this one regulated to be closed, to be open, will come in as an afterthought. It will come in after we have dealt with this problem. So my call and the call from the Portfolio Committee, like I said when I started with you, when I was associated with health in KwaZulu-Natal, I was part of the campaign that I led to go and clean up Umlazi, because I saw and we knew that if you have garbage all over there, you are already creating a space. Now, this has escalated countrywide. This has gone all over. And people are no more buying doom for cockroaches. They are buying table phos as a organophosphate to kill rodents, because rodents have since encroached into their space of living. That's where we need to actually look at the problem.
Dr. Sibongiseni Dhlomo, Chair of the Portfolio Committee on Health. Appreciate your time. Thank you so much for speaking to us. Dr. Dhlomo, suggesting that one of the key challenges around the spread of disease and obviously what's led to contamination in certain instances has been the uncollected garbage in most areas, particularly in the townships, and that's what he is advocating for.